Welcome back. All across the state schools, they're opening their doors for the new school year now, and as kids head back, there will be new COVID-19 guidelines. Our 9 health expert, Dr. Payal Kohli, joins us to break this down and tell us how it's going to affect kids. Thanks for coming on again. Good to see you.
Good morning, Gary.
All right, so what are these new guidelines and how it's going to affect kids?
You know, some big changes that all basically are signifying that we're stepping back and allowing infection to happen. So kids no longer need to be 6 feet apart. Kids no longer need to do a strategy called test to stay. So if they're exposed to somebody at home that's positive, they don't have to continuously keep testing and test negative in order to come back to school. They're allowing mixing of different cohorts. So that's called co-hosting and mixing. And of course, they've given up on contact tracing altogether in schools. They've only reserved that now for high-risk settings like prisons or nursing homes.
So how will this affect parents other than the obvious? I mean, I'm sure it'll make it a lot easier for a lot of parents because, you know, trying to figure out how to keep the kids home was tough.
Yeah, you know, obviously less time away from school, less time away from work, which was really the intent of some of these strategies. But I think it really does signify that what the CDC is trying to say is that we have shifted now into a different mode. And what I think parents need to be mindful of is that this is okay for their kids as long as those kids are vaccinated. And that's one of the reasons the CDC has now decided to do this in schools, is because vaccines are available for pretty much 6 months onwards kids. So if your kids are not vaccinated, parents, then this is still a high-risk setting for your children. So just make sure before the school year starts, you start to get them vaccinated.
Yeah, and this doesn't, just because they're doing this doesn't mean COVID's over, right?
Not at all.
Yeah.
But what it does mean is the CDC has put a flag down into the ground saying we're now officially in the endemic phase. It's also the CDC saying let's shift our philosophy and go from preventing infection to now just preventing severe infection. And I think it's a big change. I think philosophically it marks a big change. I think the CDC is trying to gain back the trust of many of the people.
Yeah.
Because if you look at survey data, Gary, people are already doing this. 54% of people are no longer wearing masks indoors. 40% have gone back to their pre-pandemic routines. So the CDC is now saying, okay, we hear you, and we think that this is okay under these circumstances.
What do you think? Are you okay with this?
You know, I have mixed feelings about it because I think it's 2 years in. We do have vaccines. We have ways to keep people out of the hospital, but I don't think we have all of our ducks in a row yet. Specifically, we don't yet know what long COVID implications there are from Omicron. So I think the CDC should really be gathering a lot of data on that and saying, if we just, you know, let it rip and have everybody get infection, what does that mean for people 5 or 10 years later? And then the other piece of this is the treatment, the Paxlovid. I have patients every day in the office that tell me they tried to get Paxlovid, they couldn't get it, they weren't treated. So I think until that becomes ubiquitous, this is still a little bit of a risky move.
Yeah, still lots of questions out there, more questions than answers, I'm sure. Dr. Kohli, good to see you.
Good to see you too.
Okay, thanks.